So we'll start the next part of the series. A 50-year-old male patient who is recently diagnosed as hypertensive and is on AC inhibitors had reported with a swelling in his both the lips. What could be the diagnosis? So the key term here, patient is taking AC inhibitors and he had reported with a swelling on in his both the lips. So it's a clear-cut case of angioedema because of the history of taking AC inhibitors and the characteristic feature of uh, lip swelling. It's an adverse effect of AC inhibitors. So now focus on question number 387, and you can see the radiological sign here. So you have to identify the radiological sign. What is that? It's a clear-cut case of Codman's triangle, and it is seen in osteosarcoma. So it's a Codman's triangle. Both of these questions are very much important for upcoming entrance examination. Now this is also a very much important questions. You have to identify the condition related to this kind of radiological feature of skull. It's a moth-eaten type of feature or pepper and salt type of lesion. Diffuse radiolucency, scattered radiolucency. So what is the diagnosis? Is it multiple myeloma, Paget's disease, osteomyelitis, or fibrous dysplasia? It is also a very easy question, often asked in the examinations. It is multiple myeloma. So next question. Identify the salivary gland tumor which has marked tendency to spread through perineudal spaces. So here the key term is it spreads through perineudal spaces. Options are mucoepidermoid carcinoma, pleomorphic adenoma, adenoid cystic carcinoma, and Warthin's tumor. The answer is adenoid cystic carcinoma. Next, you can see the white patches, and some white patches are ragged kind of thing, and some abrasion kind of thing also there. So what is the diagnosis? It was a picture of aspirin burn. It was not leukoplakia or any other options. It is aspirin burn. So aspirin is a caustic agent, and if it is left in contact with mucosal lining, it will create this kind of aspirin burn lesion. So it will heal itself within 7 to 10 days. So this was the picture of aspirin burn. Now next question, you can see in this picture a 6-year male patient complains of fever, sore throat, and dysphagia since 1 week. You can see the white pseudomembrane, or you can't say that it is a pseudomembrane, a white patch over the peritonsillar region. Options are scarlet fever, anog, diphtheria, harpangena. It's a clear-cut case of diphtheria. Answer is diphtheria. Now we'll go to the next question. Which of the following drug may be associated with this condition? What is the condition? Gingival hyperplasia or gingival enlargement. Options are dilantin sodium, aspirin, amoxicillin, rabeprazole. Answer is dilantin sodium, also named as phenytoin. So, next question, you can see the picture. I am zooming the picture. You just see the lesion. It is in the both of the lips. Options are recurrent aphthostomatitis, xeroderma pigmentosum, recurrent herpes labialis, and erythema multiforme. It's a case of recurrent herpes labialis. So we'll move to the next question. (394). It's a clear-cut case of what? Radiation caries. I don't have to explain. I know that it's a radiation caries. Now next question. The following condition begins as a small ulcer of the gingival mucosa which rapidly spreads and involves the surrounding tissues of the jaws, lips and cheeks by gangrenous necrosis. What is the diagnosis? Is it rhinoscleroma, coccidioidomycosis, cat scratch disease or noma? You can see the gangrenous necrosis, all the cheek portion of lip distracted by gangrenous necrosis. It's a noma, N-O-M-A, noma. Now go to the next question. You can see the clinical appearance of this patient. A 40-year-old male patient presented to the clinic with the following clinical feature. What is the diagnosis? You can see the glandular enlargement of submandibular, sublingual, submental. So it's a case of Ludwig's angina. So here I stop today. Oral pathology series finished. We'll make other videos and different topics we'll cover. This much for today. We'll meet you in the next video. Thank you very much for patience listening.